So welcome everyone. My name is Krishna Williams, the Director of Development and Alumni Relations. And so I want to welcome you all to our fourth and final critical convo. It has been an amazing month. And so I'm excited just to, to end it on, I would say a high note in terms of the presentation that was going to be presented today. And they all follow some great people. So I'm sure they're up to the task. And so I will take my cue and turn it over to Regina. Hey, Regina.
Hi, Krishna, and good afternoon, everyone. Welcome, welcome. On behalf of the Alumni Association Board of Directors, I want to thank you again for joining us for the final installment of the Fall Critical Conversation series hosted by the Alumni Association. I am an alum of the school, class of 2005, and I am thrilled to introduce to you all our speakers for today, Dr. Jodi Jacobson Frey, as well as Dr. Unick. So Dr. Jodi Jacobson Frey is a professor at the University of Maryland. She's a professor at the School of Social Work and chairs the Social Work in the Workplace and Employee Assistance Subspecialization, which was formerly the EAP subspecialization. And she also chairs the Financial Social Work Initiative. She's the founder and faculty executive director of the newly launched Behavioral Health and WellBeing Lab, BHWell. Is it BHWell or BHWell? BHWell Lab.
BHWell's good. I like it.
BHWell. I like it too. BHWell Lab, which we will hear about today. And she also co-chairs the University of Maryland Mental Health and Addiction Health Disparities Think Tank. She too is an alum of the school, earning both her MSW and PhD degree from the School of Social Work. Dr. Unick has over 20 years of experience working in behavioral health research. His recent work is focused on implementing telehealth interventions in community behavioral health settings, improving behavioral health crisis services, and working with community-based organizations to increase access to evidence-based treatment, such as medication-assisted treatment. He's widely published in the field and has been funded by multiple National Institutes of Health grants. So I am going to turn it over to Dr. Frey and Dr. Unick to begin today's presentation. Thank you for being here with us.
Thank you, Regina, for the warm welcome. We're so pleased to be here with you and with all of the alumni board to be able to present about the new lab. Thank you to Krishna and Shantae and everyone in continuing ed and alumni relations for making this topic one of our critical convos. It's exciting, again, to be here and to share some information with you and to have some discussion. So our plan today, Dr. Unick and I will present about the BHWell Lab and talk a little bit about our thinking and what we're trying to develop to foster research to practice and practice to research from the School of Social Work and working with our community partners. We will probably present for about a half an hour, and then we will have lots of time for Q&A. So if you can think of some questions as we're going through some of the slides. We will also make the slides available as a handout, and we'll be able to put that in the chat soon. But please feel free to use the chat. It's a little hard for me to be able to see that and the slides, so we will have a lot of time for questions and discussion. So again, welcome everyone to the Behavioral Health and Wellbeing Lab, or what we like to call the BHWell Lab. I want to start by talking a little bit about the need for this lab and some of our ideas behind it. The lab, if you haven't seen the website, which will go in the chat, is BHWell Lab at ssw.umaryland.edu. And it just launched this past spring, kind of a soft launch, but it's something that's been in the works for a long time. And as Regina mentioned, I'm a proud alum of the school. I've always focused my practice and work on adult and emerging adult behavioral health and well-being. And for those of you that know me and heard a little bit of my bio, I tend to get into spaces and places where social workers aren't always practicing. And if they are in those settings, they don't always have a leadership role. And what I found being at the School of Social Work and being in the social work field for several decades is that there's quite a a bit of work going on, both research and practice in behavioral health and well-being, that is social work centered and focused. Yet it seems like we don't always think about social workers as taking a lead in doing work in this area. And so with our School of Social Work, and I know many of you are alum that are on the presentation today, you know that we've had a really strong emphasis on child welfare and also an infusion of research funds on aging. But we haven't had as much attention centered around the work that many of our faculty, staff, students, and alumni do with adult and emerging adult behavioral health and well-being. And so we were thinking maybe 2 years ago about a need for this group, which has developed into a lab. And we'll talk a little bit about that concept. But it used to be that, you know, within the University of Maryland, a lot of times researchers would be writing a grant. Maybe it's about substance use. Maybe it was about mental illness. Maybe it was about trauma or violence prevention. And outside of the School of Social Work, they would recognize that there was a role for social workers on their grant, that they wanted to maybe work on talking about social determinants of health or thinking about community-based practice research. And we would often get an email, you know, who's doing this work? And can you help out with School of such and such on a project? And it would turn out that there's quite a bit of us at the School of Social Work who are doing these types of projects and research and teaching and service, but yet we weren't coordinated in any kind of central structure. So that's where this idea for the lab came from, where we really needed a space and a place for social workers that are committed to developing and disseminating collaborative research on behavioral health and well-being with adults and emerging adults and working families and the community, to really take a lead and center ourselves as researchers and practitioners. So in the chat, I would like you to think back, and I'm going to give my age here, but there was a 1989 movie with Kevin Costner, and he lived on a farm with his wife, and he was a big baseball enthusiast, his dad actually. And the theme from this movie was, if you build it, they will come. Does anyone know? Oh, Dean Postmus, you are right on target today. You have had your coffee. Field of Dreams. Yes, I need to make the next one harder, I guess. Field of Dreams. If you build it, they will come. That is part of our motto for this lab. And many people, when you do a lab or a center or an institute, you're lucky enough to have $1 million, $2 million, $3 million, $5 million endowments to start these types of projects. But in fact, we're taking more of a grassroots approach aligned with our social work values to say, we're not going to wait until we have that large endowment. We're going to build it now, because the need is now. So much is going on with the communities that we serve, where we need to have better evidence. We need to work with our community partners to use data to inform research and practice. And we need to be informed by our community partners in terms of what we should be teaching and what we should be doing for research. Not to say that we're not trying to get grants, and we'll highlight a few of those, but we're working in many different ways to fund our lab because we don't have an endowment and we don't have multi-million-dollar grants to start this, but we've decided to start it anyway. And we're excited that you're here to learn about it. So the idea of the lab is to be flexible and responsive to changing needs of the community, including the workplace. We're very inclusive and aware of trying to kind of shift what's needed to reflect the needs of a changing world. We want to also be very inclusive of our faculty and our staff and our students at the school who are working on diverse topics that can fall under an umbrella of adult and emerging adult behavioral health. This includes working on chronic health conditions, the intersection with social determinants of health, and some of those we'll highlight today in some key projects that make up the lab. But our idea basically here is to cover mental health and well-being, financial well-being and economic justice, work-life integration, addictive behaviors, and trauma, abuse, and suicide as some of our primary tenets of the research going on right now at the School of Social Work that partners with our community partners throughout the state and beyond. So this is our lab mission. If you haven't seen the website, We've been working over the past several months to think about how we can provide leadership to the profession, how we can partner with other disciplines, and how we, again, can work hand in hand with our stakeholders to identify research needs and translate them into practice based on practice experience and community input. And so while many of our grants we'll talk about are in Maryland and have a strong emphasis in Baltimore and our surrounding community, the lab also, as you'll see, some of our projects are out of state, and we even have a couple folks that will be joining with global projects. This was something very important as we think about the strategic goals of the school, the university, and again, social work's role and leadership in behavioral health and well-being research. And I wanted to have an EDI statement as the founder of this project. So I started to look around the university to see where did we have equity, diversity, and inclusion statements that guided our centers and research institutes. And we actually don't have them at the university, but it's something that folks are talking about. So this summer, a group of core faculty and staff sat down and we mapped out what our EDI statement for the lab would be. This is a work in progress. It's something that will not just live on a website, but will guide all of our meetings. And our next meeting actually is to start thinking about how we are putting this EDI statement into practice with our research. Sometimes people think professionals, professors, researchers hide behind their research. And we really want to make sure at the lab, as a living environment doing research and practice, that we're really thinking about how do we bring our whole selves to our professional life. And that includes using our research for influencing practice and changing systems. I've been toying with kind of a tagline here of how do we put ourselves out of work? And the notion, in terms of some of the work we've done on health disparities in particular for social work and beyond, is we've spent a lot of time identifying disparities and barriers, but we have not spent equal time thinking about how do we reduce the barriers that contribute and cause the barriers and inequities in the first place. So I'm excited to have one of the first EDI statements for a research lab. As Regina mentioned in my bio, part of being a leader in this field, I agreed to co-chair the University of Maryland's think tank on mental health and addiction health disparity, which is out of the School of Medicine. And I've been putting this on the university agenda in terms of thinking about guiding statements, principles, and really putting this into action for research throughout the university. So Jay and I wanted to share a sampling of projects. Again, the idea of the lab is not necessarily to own all of this work, but really to provide that umbrella resource where we can start to build infrastructure for folks to be able to work together, to share research, to share resources and research, and to think about not working in silos as much as we tended to have done for the past decade or so in this particular field. We are bringing new faculty, new staff, research folks, new community partners into this space to have conversations about how we can work on real research using data from our community partners, thinking about collaborations where we go for funding together from foundations as well as research entities, and also thinking about partnerships and sponsorships with corporate partners who, again, have an interest in building the lab and thinking about evidence-based research, but also have maybe a project of program evaluation or such that they're interested in working with the lab on. So our funding for the lab is pretty diverse in thinking about how to structure this. And we do have a couple key projects that have helped to give us that initial start to bring together some resource sharing. So I've asked Jay to talk about one of our first projects called IRIS, Innovations in Recovery Through Infrastructure Support. And then I'll come back and join to mention a few of our other projects before we go into discussion. So Jay, I'll turn it over to you.
All right, hey, thanks, Jodi. Well, welcome everyone. Thank you for attending and joining us here. I'm very excited about the lab that Jodi has taken the lead on, and there's a number of reasons for that. One reason is that it enables projects like IRIS to be more successful by sharing resources. Erica Shook is on this call. She's a public relations specialist. That's the kind of role that is very valuable to a project like IRIS. I'll describe it in a second. But without sharing that among multiple projects, we really wouldn't be able to hire somebody that's a public relations specialist to do outreach. And Erica's been fantastic. And if you go to the IRIS website, which maybe she can put in the link or in the chat, you'll see that it looks great, it's engaging, and it's something that we just wouldn't have done in the past. So we want to work in multiple modalities to reach back into the community, and as opposed to going through traditional academic channels. I'm going to guess that most of you non-academics probably haven't looked at an academic journal in a long time, and that was our traditional method of outreach. And we want to break out of those silos, and IRIS is a part of that. So IRIS is a project funded by the National Institute of the National Institute of Drug Abuse, and IRIS seeks to build infrastructure for developing evidence around recovery supports for people that have opiate use disorder. I see Gabby on this call. So Gabby, I'm gonna call you out a little bit here on as an example. So Gabby works at People Encouraging People, which is a behavioral health provider here in Baltimore. And they have great questions. They're doing great work. One of the questions that Gabby approached us with is, how can we measure recovery and progress in folks that are homeless and living on the street? Because we have these folks that are not at a level where traditional measures of health outcomes or a quality of life outcomes are really appropriate. And that's not something that I necessarily as an academic would have thought about, but that was a practical problem that they have, because they want to know, is their outreach working? Are they moving people along a path of recovery to better outcomes? And if our measures are you having really great relationships with your family? We're just going to bump into that ceiling all the time if we try to use these measurement tools. So she approached us with a project where they were going to go out and do the interviews with existing measures. We were going to use a variety of different approaches to build new items. And then we will come out of this with a tool that will allow agencies like Gabby's to identify who is progressing along a path to recovery, who we need to spend more time and resources with, and to evaluate the effectiveness of that program. And so these kinds of engagements are active conversations between community providers and academic researchers. I have a lot of knowledge of psychometrics and how to utilize data to understand item functioning and all of that kind of stuff. Gabby has a lot of experience, and her team has a lot of experience working with people living on the street, trying to move through some path to recovery. And it's the marriage of those two ideas that really creates a synergy that helps us build a knowledge base that informs practical outcomes. A lot of the work that historically we do in research is we develop some program, we hire specialized people, and we go and do our specialized thing. And then we worry about implementation after the fact. And we want to throw that away. We want to work on these concepts of implementation from the get-go, drawing on the knowledge that community organizations have. Another key part of IRIS is that, and for those of you that are working in community agencies, you probably are collecting data from a variety of sources. If it's a health-based organization, you have EHRs, electronic health records, or other forms of data systems. If you're a social service agency, if you work with homeless, you have the HMIS system, the list just goes on and on. We collect a lot of data. But what we're finding is organizations don't have a lot of tools for taking that data, turning it into meaningful, actionable kinds of information that can then be used to build program and help evaluate the effectiveness to know if is what you're doing working, where else do you need to head on, what other kinds of things do you need to do in order to build effective programs. And so that's what we're trying to do with IRIS, is build that infrastructure, build that relationship, and sustain that relationship. And one of the things that Jodi mentioned is we're doing this with our bootstraps. So Michelle Tootin and I, who's the other PI on this project, we went out and got the money for this grant, and we are building things with, Jodi goes out and gets her money with her grants, and that's traditionally how we've done things. well, there's all this startup cost to getting those grants. We want to stop that. We want to share resources so that we have this pool of folks that know how to go out and do interviews in the community, that we have this pool of relationships that's active and sustained. So when we have some idea that we've developed with community-based partners, we have an infrastructure in order to move those projects forward quickly, as opposed to having to build things independently each time. And that's the kind of thing that you can do when you have some sort of sustained funding. And so part of our pitch here is to really encourage interaction with community-based agencies, and then to find innovative ways of funding ideas that capitalize on grants and the work that we traditionally do, but also leverage it through other ways.
I want to highlight a couple other projects. So IRIS is one of our larger grants that's connected to BHWell. And then I wanted to just spend a couple minutes with introducing you to some other projects. And then in our discussion, we can also talk more about them. I wanted to highlight the Prosper project. So this is another grant related on opioid use disorder and recovery. But this particular grant that I co-lead with Dr. Marion Cloran at the School of Medicine is focused on the intersection of substance use, recovery, and the workplace. And it's an area that comes up constantly when you talk with treatment providers and peer specialists and people who are in recovery trying to get back into work or into better work. There are not a lot of supports for adults in recovery. And what we're doing in a couple grants that we have related to Prosper, and our website is on all the slides if you want to look at these projects in more detail, is to really think about getting data from people who are involved in recovery support, people who are living in recovery, and then also talking to employers about what are their needs for health and safety, while also encouraging them to become more recovery friendly. This is a very multidisciplinary project. It's exciting to see the School of Social Work having a lead. It involves not only School of Medicine, but pharmacy, public health, law, nursing, and more. We have a whole army of students working on creating an interactive toolkit that will eventually live on the Maryland Department of Health website and be used by employers and employees who are seeking support and services for better work, for more sustained work, and for work that is supportive of those in recovery. As we know, work is critical for recovery and for positive health outcomes. One of our projects that focuses on suicide prevention is a project I lead called Prism, which is preventing suicide in Michigan men. So the IRIS and Prosper focus on Maryland, and then we're also able to work with our partners throughout the lab in other states. I've been doing research for several years now on suicide prevention with working-aged men, a high-risk group that doesn't necessarily respond well to some of our traditional outreach and communications for health and social work and well-being. And so this project, the lab was able to help support the role of Erica Shook that Jay mentioned. We were able to bring our resources together and hire someone that is not only able to create infrastructure and disseminate information about the projects in a way that our community partners can understand, and getting that on social media and other places, but also she's able to help support and grow the lab. I wanted to just mention a couple things. You know, we talked about some of our larger research projects, but we also are providing services to the community from the lab. And I think this is very important, as Jay reflected on, that we don't want to just disseminate information through peer-reviewed journals. That's important, but there are many other ways that we need to build these relationships and hear about evolving needs. And so out of the IRIS project is actually a free mental health first aid training that's being conducted and offered. The class is full. It filled up right away, which we were very excited about, to be able to offer this to partners of the lab and folks that are connected to the School of Social Work. And these are types of initiatives that we want to continue to be able to fund, so that we are not only researching things like mental health first aid, but we're also actually able to get that out to folks that want to use it, that want to learn about it, and then can give us the feedback loop that we need in terms of, do these evidence-informed practices actually work? because that's one of the big barriers. And we can talk about challenges in the discussion, but sometimes researchers come up with these ideas and they're just not realistic or feasible in the community. And I think it's very important that from the very beginning of this lab that we think about the partnerships for informing research. And I would say for Iris and Prosper in particular, those both have very active community leadership stakeholder groups, so that all parts of that study and the toolkit in Prosper are informed by what we're hearing from the community, including those with lived experience. So I'm gonna just keep an eye on our time and talk for a couple more minutes, and then I want to have lots of time for discussion, kind of building on the way that we influence system change. We're building the practices from our research into our education that we provide not only for our MSW students, but also in partnership with continuing ed. This is a program, Social Work in the Workplace and Employee Assistance, that's been around for 40 years, but really has been evolving to think about how do we prepare our social work graduates to become change agents in the workplace. And one example that we are working with our students as behavioral health experts and leaders in the workplace is to think about the systems that they're in and how to use community organizing grassroots skills as a social worker in the workplace to build allies, to gain trust, to use data to demonstrate the importance of needing reform. And I was inspired this past year to write an article that is referenced here for the Harvard Business Review. The Harvard Business Review hasn't published an article on employee assistance for over 20 years. And so I decided to kind of use the lab, use the emphasis that we were creating to shake up the field a little bit. And I wrote an article on how EAPs could be more anti-racist in the workplace. And Harvard Business Review published that, and it got lots of attention, both for our program for the school, but more importantly, to think about how to shift and change some of the behavioral health practices the way we've been doing into a way that really helps to break down barriers, disparities, and builds equity. Many of you have heard of our BWise Lifespan program, the Behavioral Health Workforce Integration Service. So also connected to the lab led by Dr. Paul Sacco and Michelle Ballou. These are programs that are evidence-informed, evidence-based, that are teaching our students how to work in integrated behavioral health programs with a very strong focus also on substance use. And if you go to their website, it's so exciting to see how expansive this program has become to provide scholarships for students that really want to invest their time while they're here in learning about best practices and research-based practices with our community partners, many of you on the phone today. So thank you for working with our school and working with our students in these important field placements, which really become the pearls of the MSW education experience. And then the last one or two projects I want to mention, the lab also is able to connect to very large initiatives. So while we have individual programs and projects that we mention, we also are expansive in terms of this one for financial well-being and economic justice to connect with our financial social work initiative. And so financial social work initiative exists independently from the lab, but there's a lot of overlap. In our 10-year anniversary, we actually redid our tagline to think about how does financial social work sit within the School of Social Work and the University of Maryland as a health campus. And so we changed our initiative to become this integrative approach to financial well-being and economic justice. And so while financial social work does have projects that focus sometimes on children, focuses on older adults, there's a lot of overlap and intersection with well-being on adult behavioral health and well-being. And we want to make sure that we are also highlighting the work that we're doing in programs like financial social work and other large initiatives and centers at our school. So that was just to give you a sampling. Again, one doesn't need to have large grants to be connected to the lab. Our purpose in developing relationships with the community is also to be able to provide a home for researchers that might be coming up with an idea or a white paper. They're looking for funding, they're looking for community partners to work with, and how can we start to foster better relationships as we think about working together to have research-informed solutions. So ways that you can get involved and keep updated with the lab. We hope that you'll join our mailing list. So there's a little constant contact drop on our website. As Jay mentioned, we want to hear from you. We want to hear about ideas that you're needing research, wanting research, letting the School of Social Work be a responsive partner to you as you think about new programs that you might want to develop, and are there ways that we can partner to support that development and support the evaluation of new projects. And we want to think about how we can be impactful in a way that looks for sustained funding. So when the grants end, the community is still able to provide those supports, and that it doesn't end when a grant ends. That's very important in terms of thinking about these ongoing relationships and rapport. So lots of ways to get involved. And there's a couple links up here as we go into our discussion that has our website. It has our email address, as well as the email for Jay and I. And we hope that you'll be social with us on Facebook and Twitter. And we are launching a LinkedIn page as well. I'd like to do a poll and then turn it over to Regina to guide some questions. But just to kind of get us started, and it's not another test, it's no Field of Dream movie question trivia, but there are 5 areas in the lab that we are kind of trying to target. And I'd love to hear what area is most important to you right now as you think about your research needs in the community organizations. And hopefully you can see the poll. Can everyone see it? Actually, I don't think our presenters can see it, but I think we've got responses coming in. Yes, we do. Great. So we'll give that a minute. And I know you might be interested in more than one, and that's fine as well. We're just trying to see primary. All right. We've got 18 that answered. I'll just give it another second or two, and then I'll go ahead and end the poll. Excellent. All right, I'm going to end the poll, and here are our results. So we've got actually a nice spread here between some of the different topics that we're interested in, which is great. I'm excited to learn from all of you what maybe more in depth you're thinking about for research questions and community research collaboration. So if you'd like to put in the chat questions or thoughts or ideas that relate to this poll, feel free to do that as we open up our discussion. And Regina, let me turn it over to you as moderator. Thank you.
Thank you, Jodi and Jay. So Jay, when you were speaking earlier about Iris, a question came in. What practices do you envision employing to break down the silos you referred to and to foster more partnerships?
Yeah, so there's a lot of things that we do in a practical kind of way, but overarching, the thing I'll say is it's being involved, sustained conversations, working with partners, particularly without money before we have money, to develop relationships, and then continuing those relationships. So a project that Jodi and I are working on a lot right now is one that is being funded by the Lower Shore Clinic, which is run by Dimitri Kapathos, who I knew when he worked at PEP here, and we've had a relationship for 10, 15 years. And we, through the course of multiple projects, he's involved in IRIS. I have another project called Medherent he's involved with. So we have a sustained relationship that's built over time. And that's one way you break through it, is you go out and you show up, and you show up at places. For me, I got to get out of here. I got to get out of my office, and I got to go see what's going on and talk to people and just do that outreach in that very human social worky kind of way. So that would be the overarching thing. I think in a lot of practical ways, ensuring that we internally are sharing resources, that we are talking about each other's grants, that we're finding synergies. So that's an internal conversation here at the School of Social Work. That's something that the lab is facilitating. And then the other piece of this is that and I think Jodi said this, and I said this earlier, I have lots of ideas, Jodi has lots of ideas, and we sit in our offices and we have these ideas unattached to reality. And it's only when we go out and sustain that engagement that we can break down these silos and have meaningful back and forth conversations where our ideas are reality tested against the practical, concrete limitations of community-based organizations. And it's that sustained conversation that enables reality testing and building ideas that have the potential for sustainability and legs. And then that gets back to fostering relationships. And now we're in a virtuous cycle. And that's what we're looking for. I hope that answers that question.
Can I add to that, Regina?
Absolutely.
I was going to give, I think those are great answers, Jay. And I was also going to say both Iris and Prosper and some of our other projects connected to Lab have really active steering committees, community advisory committees, leadership committees that are comprised of faculty, staff, students, alumni, other stakeholders. So I think that's become a trend to really build in from the beginning of a project to think intentionally about who's at the table as we develop the research questions, the research methods, and the dissemination plan. So with the Prosper project that I mentioned, for example, we have a grant with the CDC through the Maryland Department of Health to create a toolkit for employers. And again, we could sit in the office and kind of come up with the ideas and look at research and say what would work for Maryland. But we're taking a longer approach. It's more time consuming, but I think it's going to ultimately have better results where we are connecting with stakeholders that want and need and will use this toolkit to think about surveys, think about using data, think about focus groups and other community connected events where we can best understand what this should look like, what it should feel, how we're going to use it, and how we're going to evaluate if it works, versus creating something that is published in a journal or sits on a shelf and just collects a bunch of dust. So it's been, I think with a lot of the lab projects that is kind of built in. And I actually think that's a key part of social work research that, if I dare to say, sets us apart from maybe some other disciplines where we can bring some of that collaboration and activity to be centered.
Yeah. Thank you for that. Jodi, you also mentioned the necessity or the need to kind of think about partnerships for informing research, right? Can you speak to some of the challenges that researchers face when working with community organizations, and vice versa, some of the challenges that the community organizations face when trying to partner with universities in general, or academia in general?
Yeah, I think as I think about the lab in particular, we're working on some different funding avenues. And, one of them is this idea of corporate or organizational partnerships or sponsorships. And so we would want to be able to respond to a need, like a tangible need. It's a program evaluation or looking at, some data, thinking about developing an assessment tool. And we want to do that right away, but we also need to build the infrastructure. And that might mean that we have to go for a grant, and a grant takes time and it may not get funded the first time. So I think the process of like, what can we do now? Again, if we build it, they will come. So this idea, if we start doing this work and investing in the relationships, maybe we have limited resources, those grants will come. And I think that's a model that we're trying out that's a little bit different, to think about that challenge of, okay, we have this great idea and we have no funding. So we can't fund the staff in the community to collect this data. We can't fund the participants to participate and to provide incentives. And then it may take a year or two. And meanwhile, we have this need that we need to deal with right now. And so I think that's a barrier to working with universities that comes up from the community side, is that our needs are now and we needed it yesterday. And so I think in building infrastructure for the lab, my hope is that we'll be able to respond and kind of get started earlier, at least on some of the needs, or thinking about like some critical relationship building, or what can we start to do while we're writing grants to sustain that effort and to scale it up and to grow it and to evaluate it. So it's all happening together. And from the university side, I've always done research that's on the ground and in the community. And sometimes that results in non-significant results and things that nobody wants to publish. And it doesn't mean that we didn't learn we often learned quite a bit from trying out new pilot studies and projects. But it takes it's challenging to do that in a research-oriented field, where you're often validated and promoted on your scholarship and your peer-reviewed publications and your grants to take a risk. And so that's another piece that, in my position, I've been at the school now for 15 plus years, Baltimore born and bred, and here to stay. That's part of what I want to give back to new faculty, is to help them be able to take some risks and feed their passion, even though it may not end up in a big grant, or, it may not even work when we partner with the community and we realize like we need to take another tactic. And that's real research to me. I've always enjoyed very messy hands-on research, and I want to be able to support that for other people that have that passion and want to just be in the trenches with our community partners, so that we're not creating practices that make no sense and aren't sustained.
Thank you. So you all also, continue to kind of stress that you want the work of the lab to be impactful in a way where projects can be sustained, right? Can you talk a little bit about some of the funding challenges? So what happens when the grant ends?
That's a huge problem. So if you have funded positions, especially, what we find, like with some of the peer specialist programs that we're looking at in Prosper, those positions are grant funded. And so oftentimes there's, barriers in terms of infrastructure to pay for positions. So one of the things that, when I put my social work advocacy hat on, is thinking about the importance of being able to advocate for peer specialists for their services to be paid by Medicaid, which currently it's not. That's a huge barrier. If we're creating and we're finding in research that this works and it's really helping our community systems, and in this particular instance, people in recovery, I think we have to have a policy advocacy lens as part of social work researchers that also tries to influence system. Another example I'll give, during the pandemic, I was able to consult with a Fortune 100 company, multinational company, about COVID and wellness. I was on their global wellness advisory committee, and they'd never hired a social worker to work with them. And I said, if you're going to have me here to talk about mental health and resilience, we're going to talk about your frontline workers. We're going to talk about hazard pay. We're going to talk about PPE. We're not just going to talk about, different types of mindfulness and CBD strategies that you could be offering for wellness. We're going to get into your core policies and your programs. And they said, that's why we want you here at the table. And so that's part of, I think, trying to encourage the lab's, stakeholders, the community folks, the faculty, the students, to bring your full self to this work, and to start thinking about the implications of this research, so that when the grant ends, the work continues. And I think we have to do that from before you even get the grant. And so when Jay was saying, like, he's out, he's going out to visit the mobile treatment programs, he's got, going up to different counties to see, how these programs are functioning in reality, or going over to Eastern Shore. That's really important to hear and to see and observe, so that the grants that we go to try to get to support the programs are building the infrastructure for the community organizations.
Yeah, one other thing I'll add to that, and I think those are great points, Jodi, is people are successful at sustaining themselves. It's hard, right? It's anybody working in community-based organizations knows that it's a struggle, but people have lots of successful models. And when we can engage in lots of organizations that have lots of different sustainability models, we can then create a conduit to share that information we can provide a forum for community-based organizations to share amongst themselves what works. and Jodi mentioned Medicaid, even learning how to bill Medicaid, how you can start up billing Medicaid. One of our partners, BHLI, has recently been struggling with how to do that. And they've developed a whole bunch of knowledge on how to do that. And that's the kind of thing that we can share with other organizations. And so creating a space to have this cross-fertilization of ideas, whether or not they're generated internally or externally, I think is one of the primary functions of something like the BHWell Lab.
Sorry, that's why they tell you to say it again.
There's a question in the chat.
Yep, I was going to it next. That's why they tell you to stay unmuted when you're participating in a webinar. So yeah, all good stuff. Thank you. So yep, there's a question in the chat from De'Ara Nelson, a 2020 graduate of the school. How often do you do a community reevaluation? So you start a program, it runs a year or two, or it's funded for a year or two. How often is that need assessed to make sure that you're staying up to date with the needs and outcomes, et cetera, et cetera?
All right, well, I'll start with one of the great things about the modern world is we collect a tremendous amount of data already. So I think one of the things is let's get away from this idea of the evaluations being discrete events that come and go, and think of it as how can we build an infrastructure that is continuously asking the question, what's working? Is it still working? Is it still working? Things change, right? And so something that worked yesterday isn't going to work today. Populations change, populations that you serve, funding streams change, et cetera, et cetera. So I think learning how to, and when I say learning, I don't mean I'm teaching somebody else. I mean, this is stuff we're actively all learning together right now. How do we use these information-rich environments that we've created through electronic health records or other data systems to create meaningful information that can then be acted on regularly and on an ongoing basis? So let's stop thinking about evaluations as one-offs and discrete events, and let's start thinking of them as a continuous quality improvement system. So that's one thing I'll say. The other thing is that I would be, I think one of the hard things is understanding, one of the things that's always hard with these conversations is people want to know, is my program successful? Okay, well, what do you mean by success? How compared to what, right? These are complicated questions that are hard to do in even specialty research environments, much less in a community-based organization that's just trying to understand what they're doing. So figuring out how to ask the right questions, I think, is a critical part. But once you do that and you have data systems to support that, I think we can have a continuous conversation around what's working. And that's sort of where I would push that conversation.
Yeah.
I think those are great ideas in terms of using data. I think the other piece is sometimes I hear from community organization leaders that they feel like they need to have a researcher on their staff to do some of the evaluation. And in fact, they have so many of the skills themselves to be able to do that work. So I think part of the partnership is to think about sharing resources, not only internally to build the lab and the infrastructure, but also to be able to share resources with our community partners. And if we, in the process of a grant, identify some leading indicators, what are some metrics, maybe a smaller number that they could follow up on and kind of have as a manageable assessment marker to do, whether it be kind of an annual check or to think about surveying their constituents. I think we can learn from each other in terms of how community organization leaders and community partners and folks that are receiving services as well, how do they see success, as you mentioned, Jay? And how do they see, are things still working, or does our system need to be updated or completely revamped? So having the communications both ways. I know when I do my very messy research, before I publish it, I'm always having conversations with the partners to kind of check out, what does this mean to you? And what is this finding? And what I have found over 20 years is a lot of times they interpret results very differently, and it has different implications for practice. So being, again, out of the ivory tower, I think, and just being on the same playing field as, folks that are wanting this research and going to use this research is really important to break down the barriers of working on the academic side. Like, I can't just be like, hey, I need some community partners to work with. I have to invest in building
Right.
relationships so that community partners want to also work for me, and then I'm learning from them. And I find the partnerships go on for a long time. So like with financial social work, we've had, partnerships with Consumer Credit Counseling Services of Maryland and the Cash Campaign for many years, since the initiative started over, 10 years ago. And what that's meant is that we're working on policy advocacy, working on practice, we're working on training, continuing ed, master's and undergrad classes. And then when research grants come up, we already have that relationship and we know each other's strengths. And so it's just a more natural opportunity to go in together to, again, go back to assessing is like, hey, what we did a while ago is still working, or should we maybe go in for this grant and think of developing something new?
I appreciate the reframing from simply evaluation to CQI. So thanks for that. Thinking about centering social work in behavioral health and well-being, we as social workers, it's not an add-on, right? So how do we center and frame this work within social work values and practice, thinking about a holistic and comprehensive approach to, wellness, essentially.
So I think, part of we're kind of building it as we go along, but this notion of, oh, I should bring in a social worker to address homelessness or to address poverty, like they're add-ons to often what we see in more medicalized settings or clinics. And we're trying to switch it up to say, actually, like the root cause here is poverty. The root cause here is systemic racism. The root cause, like, let's add the clinic-based services onto the social problems that are root causes. And that's going to be a challenge, I think, in funding, Regina, because our funding streams tend to be very, like, what's the word, problem oriented, and they tend to like be very narrow. And I think social work's frame is that we need a broader, more comprehensive approach, like you said, and that we're not just adding on the systemic issues to a narrow based problem. And that's going to be a shift in funding, which in suicide research that I've been doing for 20 years, I'm seeing it. So I used to get declined all the time for research projects because I followed a more comprehensive, multidimensional, multimodal, community-based intervention is what I thought we needed for suicide prevention. And most of the funding, from NIMH and other places was on biological markers and medication and, very specific intervention treatment, whereas I'm trying to do community-based public health social work programs. And I saw a shift, in terms of looking at a more social work view from the CDC, which is one of the projects that I've been able to get funding connected to the lab, because they do share some of our vision in thinking about really a more comprehensive approach to these complex struggles that social work is involved with. And I think we add on the other pieces if we can center the social determinants of health, if we can center the root causes of what, is exacerbating and causing the health disparities and the lack of access and the other systemic challenges that we see. Otherwise, we're always going to just be going grant to grant to grant and continuing this cycle. So I do think there's some challenges for us as we try to center social work. But that, to me, is what we should be trying to do.
I think the evidence is also coming around to social work side. I think we've been in these, when I hear other disciplines start talking about social determinants of health, I wonder what you've been doing for the last 100 years. Social workers have been there from the get-go, thinking about housing issues and poverty and the role that these phenomena play in health outcomes. It's sort of obvious. There's a story I like to tell where I was getting together with some of my colleagues that were were encouraged to do this intervention to deal with individuals that were to reduce utilization of acute care hospitalizations and things like that for individuals that were high utilizers of those systems. And they weren't showing up at the clinic. And so what they wanted to do was build a clinic with restricted hours, because that's what pharmacists and nurses and doctors know how to do, is build a clinic. But I know that's not going to work because they're already not coming to the clinics you already have, right? We have to go out in the community and do things. And the social work perspective is an evidence-based one. And I think as we follow the evidence, it's becoming increasingly clear that we need to change the way we're operating. And I think Jodi highlighted this holistic perspective. We can't just think in these narrow bands about medications. You know, vaccines are great. I'm a full supporter of vaccine. I will get vaccinated as much as I can, but vaccines haven't solved the problem because there's other things going on as well with this conversation around COVID. We have to think in a multidisciplinary way. We have to think in a multidimensional way, recognize people are whole beings that have lots of competing priorities. That's a very social worky kind of perspective. And I think the evidence is pushing us in that direction, even other disciplines like nursing and medicine and public health and pharmacy. They're coming back to us.
Yeah. And so I think that you all have this is a great segue into my next question. And I mentioned this to Jodi on yesterday, Jay, when we did our quick check-in. I am a part of the school's strategic planning team, right? And in particular, I've been assigned to the innovation and reimagination team. And so just to give a little bit of context, the school, the UMD, has just undergone the strategic planning process. And now the School of Social Work in particular is now developing its goals, right, that feed into some of these outcomes. And so when we think about, in particular, innovation and reimagination, that entails, nurturing an environment of research and discovery, right, that probes and answers challenging questions, all to improve the human condition. That involves a broad and collaborative culture, right? And finally, well, I'll stop there. So I guess my question is just, when we think about innovation and reimagination, what's your vision for this lab at the school moving forward in the next couple of years?
So I can jump in and please add. I love the innovation and reimagining. I think that the time is overdue for that. And the time is overdue for social work to have a central role in behavioral health and well-being with adults and emerging adults and working families, and becoming a leader in understanding how to do research, how to, work more effectively with our community partners so that we're working together to solve problems. So when you asked, Regina, about the barriers, I want it to be enjoyable. I want us to feel like the community and the university are a coherent group, that we're speaking the same language, and that we're seeking each other out for knowledge and for partnership. Because to me, that's the only way that research, back to, I think it was Diara's question, how do you know if you're successful? It's if it's being used, So my goal for the lab is that we are going to really be recognized as a central place where people within and outside of the University of Maryland can go to see what's happening in research. How can I benefit in the community as a provider, as a consumer? How do I benefit from what the university is doing in the lab? And how do I partner to inform research agendas and ultimately policy and funding for programs and for strategies that kind of put us out of work? So that's my vision, as I mentioned, we're kind of building it as we go along, but it's been really amazing to talk with folks in and outside of the university about how excited they are to be part of this work and to think about what their role could be, and to think about how they can get involved in changing and improving the quality of life for others.
Thank you, Jodi. Jay, anything you want to add?
Yeah, I mean, I think of this in two ways. One is on the inside of the school, innovation, how we can be better at what we do and innovate internally, and then external innovation kinds of considerations. So internally, one of the things that's hard with grants is you get a grant, they tell you you were funded last month, but you didn't actually receive the letter that you have money until just now. And so now you're sprinting as fast as you can. And you waste that first couple of months really just trying to hire staff and get people on board and hand out the stuff that you need to do. So by having this infrastructure internally where we've built this sort of sustained thing where we already have research assistants and project managers, people that know how to work with community partners, these are relationships that we've been talking about, we're now ready to go from the get-go. So we're not spinning our wheels that first couple of months. That saves us a tremendous amount of time, and that's efficiency. So that's innovation internally, and that's something that I think we're building. And we talked about Erica, for example, who's just great and can help us build a website, and it looks fantastic. And now we can start reaching out to people. Like that's synergy and effectiveness. In terms of external relationships, I think that we need to, these sustained relationships build opportunities for a whole host of things. So one of my projects is Medherent. It's a device that was developed by a local pharmacy, Terrapin Pharmacy here in Maryland. It dispenses medications for people that live in recovery housing or in supportive housing facilities for people with severe mental illness. It has, it's got all of this fancy technology. It dispenses their medications. It does all of this stuff. But unless it's used by agencies in specific ways, it doesn't improve the service delivery.
Yeah.
Technology is fancy, and I have tons of apps on my phone that I never use, and lots of things are called innovation that I never see again, and blah, 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 blah. So that's sustained relationship allows us to understand what is a problem at an agency. Where's the workflow of the agency breaking down? Where are the bottlenecks? Where are the stuff that makes staff life difficult so that you lose staff and that creates staffing problems in the future?
Yeah.
Like, these are things that you don't know sitting in an academic office. These are things you know because you're out in the field talking to people every day. And then that helps you think through how to innovate with technology. So these relationships enable the implementation of innovation and technology, which is really what we're after, right? Like shiny baubles are one thing, but that doesn't help us. I don't sell a product, right? I don't have a fancy phone that I sell. It's these ideas that are implemented that improve the service delivery system. And that happens through these relationships. So I think that these relationships enable innovation by putting us on the ground and letting us know what the real problems are. Where do we really need to have the technology to solve the issues?
Thank you. Thank you. I'm like taking notes. Even though I know it's going to be recorded, I'm like, yeah, this is good. So final question before we go to you all for your closing remarks. I just want to talk, you both talked about, I'm just trying to figure out how I want to structure this question. I guess I want to understand the utility of the research, right? And you talked some earlier, Jodi, about, policies, right? Policy advocacy and internal practices, et cetera, et cetera. But just sort of some of the barriers and gaps to accessing as well as implementing, the research, how you've used the research. Does that make sense? I'm sorry, it's not a fully fleshed out question, but just thinking about what have been some of the barriers and gaps to accessing and implementing the research, and how has it been used?
I do think funding is a big barrier. And I think when projects have been developed in silos, which is the norm when funding runs out, innovation, reimagining, policy change, service, like it ends. And, I think about a project I did with the CDC, Healthy Men Michigan. So that was a very grassroots organized public health campaign approach to suicide prevention. And in order to really implement and get people using the website where the randomized controlled trial lived, we needed community partners to be sharing that information. We weren't in Michigan. We don't work at every community organization throughout the state. So it took a lot of relationship building. And what happened at the end of that grant, Regina, was something unique in the sense that is different from how some other projects have run. We built over 230 partnerships throughout the state that were promoting this campaign. And the grant ended, but the partnerships continued. And we were able to foster with 2 local organizing units in the state to share our partner lists and resources, to do kind of a final survey and to shift and like almost succession planning, really,
Yeah,
to think about like all this work we did for the past 4 years on this randomized control trial, how do you keep it going? And they were able to adapt and shift into working with organizing entities in the state that not only provided service and education, but influenced policy. And what it has recently resulted in is the state going for a large grant to reduce suicide by 10% in the next 5 years. And they built in this intervention as one arm of their comprehensive plan. And so I'm able, honored and privileged to be involved in a much smaller role. But that research, because it showed impact and it had results and it could be scaled up, and we built in over the time the investment, they continued it without me, to think about getting funding from the state. And I think it's a great example of spending the time,
Mhm.
working on getting grant funding that allows you to spend time, which is challenging because it's going to have such a more impactful outcome that can actually be sustained. And that is part of centering social work. And that's part of the EDI statement of the lab, is to not go into communities to abuse and to take, but to think about sharing ideas, infusing resources, and leaving the resources that the community owns the program, the community owns the project, and that the community helped identify what that should look like in the first place, so that when the academics are gone, when the grant is gone, it can still be sustained. And maybe they'll invite us back and maybe they won't, but that's up to the community.
I think that was a great example.
I think that another, and this is something that I learned from Jodi, because she is a superstar at this, is engaging in partnerships outside of a traditional social worky kind of partnerships, for-profit companies. My adherent grant that I have started with an SBIR, which is a small business research initiative funded by NIMH, National Institutes of Mental Health, with the primary recipient of the grant being this Terrapin Pharmacy group that I work with. And because they are a for-profit company, an ongoing concern, they have capital and they can continuously invest in the product. And this relationship works because they're interested in doing something good and making money off of it. And I'm interested in working with community-based organizations to get this product to be used effectively to improve the quality of care for people that live in residential treatment facilities or serve community treatment teams. And it's that partnership that helps build the sustainability in it, because there's a built-in financing mechanism. And so thinking differently about what our traditional roles are and where we can find partnerships and how we can capitalize on the huge economy and for-profit companies to leverage those resources to improve quality of life. I think that there's a lot of room for innovation in social work that's able to think through those kinds of questions in concrete ways. They're hard conversations, right? They're a for-profit company. I'm a social worker. These are not exactly natural marriages, but with honesty and with ongoing sustained relationships, that's where you can build these kinds of systems that have some sustainability to them.
This has all been great. I hope folks have been jotting notes down as I have. I guess I would just, reiterate a couple of things, Jodi's slide in terms of how you can get involved, follow the lab on social media, join the mailing list. And I'll turn it over to you, Jodi and Jay, maybe if you wanted to each take about a minute just for any final or closing thoughts that you want to leave our participants with, I guess.
Let me start. So let me start so you can have the closing words. I'll speak quickly. We are here for partnerships, and if you guys are interested in something that you think the school can do for you, and you work with adults or emerging adults, please contact us. We really are happy to talk. We have a long view of this, and we mean what we say. We really do believe in these sustained relationships. And I'm happy to come on out and talk to you about research ideas or thoughts that you have. And so please don't hesitate to reach out to us.
Yeah, I think reaching out and us reaching out to you on the call today, the relationships are really important. So, I've been at Maryland for a long time, even did my undergrad and my master's here. So I'm here for the long haul, and it's such an honor and a privilege to be in a position at the school where I can think about imagination, creation, innovation, and take some risks. Right now I'm doing the lab pro bono, and I'm proud of everybody who's jumped on board and to start growing this. Yes, we're trying to build infrastructure, which includes funding, but I'm pretty dedicated to growing something different and raising the bar for social work practice and for our profession in a way that we're working in partnership to be more responsive to the changing needs of the community. And as Jay mentioned, we're here for the long haul, and no idea is unimaginable. We might not be able to do it tomorrow, but let's plant some seeds together and let's start building relationships so that when you have a challenge, when you think about wanting to work with a partner, we become a natural link for you, and vice versa, that we get to know your programs, that we can start looking for funding that might make sense in different strategies and from different mechanisms. And I think together we can really center our values of social work. We can really learn to develop our guiding principles for our equity, diversity, and inclusion statement, and continue to challenge ourselves as researchers and alumni, community practitioners, and our students to think about how social work can be more equitable and responsive for behavioral health and well-being. So I really look forward to talking with many of you, and I hope that you will connect with us. And thank you, Regina, for moderating our session. It was really great to have this opportunity to talk with all of you about the BHWell Lab.
Thanks to you all. And I'll turn it over to Krishna. Any closing comments?
Well, I just want to thank everyone. Thank you, Jodi and Jay, for presenting on the BHWell Lab. I think that for our alums, it's going to be a great way for them to engage with the school. Yeah. Just another way for them to engage with the school. So I so appreciate that. And thank you for being great presenters, per usual. And thank you, Regina, for your moderating expertise. It's been great. And so look, we're right at 1:15, but I do want to leave with this one thing. And although our critical convos have come to a close, we will, in November 4th, please join us for our trivia night. Another email will be coming out, so stay tuned for that. It'll be our first virtual trivia night. So I'm sure everyone's excited about that, right? Maybe some trivia about the BHWell Lab in there thrown in. So no, but thank you all for joining us today, and enjoy the rest of your day. And thank you, Shantae.